Implementation. Perform hand hygiene to minimize the risk of nosocomial infection.
Your nurse today taking care of you.
Identify the client by checking the client's identification band using 2 identifiers. This ensures that the right client receives the correct medication. Verify allergies by checking the client for an allergy bracelet. I explain the purpose of the medication to the client to reduce anxiety. Arrange your work area and position the client in the bed for comfort, privacy, and accessibility. Raise the bed as needed to protect the nurse's back. Apply clean gloves, reduces transmission of microorganisms and risk of blood exposure. Inspect and palpate the IV site for signs and symptoms of infection, infiltration, phlebitis, or dislocated catheter. Clean the injection port thoroughly, 6 seconds, with an alcohol swab. Insert the saline flush syringe and pull back on the plunger of the syringe in order to aspirate a small amount of blood. This confirms that the port or IV site is patent. Flush the IV access device with the appropriate amount of saline, 1 ml every 5 seconds, 3 to 5 ml for peripheral, or 5 to 10 ml for central line, using the push-pause method. This method creates turbulence and maintains patency of the IV catheter when fluids are not infusing through the catheter. Administer the medication by IV push at the recommended rate using a watch or digital readout to time the medication administration. This ensures safe drug administration because a too rapid injection could be dangerous. Dispose of syringes in appropriate receptacle. Do not recap. Flush with the appropriate amount of saline at the same rate as the medication was administered. If applicable, flush the port with 2 to 5 milliliters of heparin, 100 units per ml, using positive end pressure while clamping the port. This maintains patency of an open-ended catheter. Observe and/or assess the client closely for adverse reaction and response to the medication. Return the client in bed to a safe position. Discard supplies. And remove gloves and perform hand hygiene. Document IV push on MAR. Observe and assess client for any variances to the expected response to the medication. Document any such variances. Whenever practicing skills on the mannequin, be sure to reset the mannequin in its original position and retrieve your supplies.
Thanks.